Hi, my name is Tracy Plouck and I'm the Director of the Ohio Department of Mental Health and Addiction Services. As we approach the end of the calendar year, I wanted to take a moment and reflect on some of the accomplishments that we've experienced in the last 6 months. As you may be aware, in July we became a new cabinet agency after merging the Departments of Mental Health and ODADAS. And that's been going pretty well, and we've got our strategic plan now effective. October 1 it went up on the website, so I encourage you to take a look at that if you haven't already reviewed it. Also, as a result of consolidation, we're able to save more than $1.5 million in administrative costs this year compared to last year. And in concert with the Governor and the General Assembly, we are making that investment by redirecting from those admin expenses into partnerships with sheriffs and jails. The concept is that a community can infuse a moderate amount of resource in the jail system for mental health and addiction services and help to improve people's outcomes and reduce recidivism and save on other public sector costs. So this fall we did a series of proposals, and we have funded 12 local projects for this year that will serve 22 counties. And these are partnerships with our local ADAM boards, providers for mental health and addiction services, and local jails. So we're very excited about that and look forward to a lot of positive progress as the year progresses. In addition to our community innovations partnerships with sheriffs, we also have a pilot in the budget for this year that focuses on partnerships with 5 specific drug courts around the state of Ohio. And this is to introduce medication-assisted treatment for individuals who are addicted to opiates and are participating in those specific drug courts. There were $5 million set aside for this, and we are going to go live in January in these 5 communities. So we're very excited about seeing that progress as it unfolds. Individuals who are struggling with addiction are a serious focus of our department, and housing is something that is really necessary to make sure that an individual has all the supports in place for his or her recovery. Earlier this year, we undertook an environmental scan with the Ohio Council of Behavioral Health Services Providers, and we came up with this report which talks about the different recovery housing opportunities throughout the state of Ohio. It inventories the sober housing or recovery residences, as they're known, that exist throughout the state, examines promising practices and evidence-based practices from other states, and it will help us to build a solid foundation for future investment in our system as we go forward. If someone goes through residential treatment and prepares to return to his or her community, but they're going back to the same sort of housing where people are still abusing substances, it creates a tenuous prospect for their recovery. And so we believe that the establishment of additional recovery residents around the state will be something that will be very helpful for folks who are served in our system. With changing subjects now, we've been successful in the last few months receiving a number of federal grants. We are proud to be the recipient of the Engage grant, which is $1 million each year for 4 years to focus on building infrastructure throughout Ohio to support the needs of transition-age youth. Additionally, we received the SBIRT grant, which stands for Screening, Brief Intervention, and Referral to Treatment, for individuals who present in a primary care environment, and this enables the doctor to help screen them to discern whether they may have a substance use disorder problem in their lives. This grant is about $2 million a year for 5 years, so $10 million total. And then finally, we were very pleased to receive a Safe Schools grant, which is about $2.3 million a year for 4 years, that will provide for an intensive prevention and treatment continuum in some specific counties around the state. And so we're very pleased that we will be able to move forward with these additional prevention and treatment opportunities as a result of our federal partnership. We were really pleased to receive national recognition on a few fronts in the last 6 months. First of all, the Joint Commission is a national organization that accredits inpatient hospital sites around the country, and 3 of our state psychiatric hospitals were designated as Joint Commission top performers. Those are North Coast, which is up in Sagamore Hills in northern Summit County, Heartland, which is in Massillon, and Twin Valley, which is right here in Columbus. So we were very excited to receive that recognition. I think it really speaks to the very high quality of care that's offered to patients who have the need to visit us in an inpatient capacity. We also received national recognition on another front. There was a study conducted by Mathematica, which is a national research organization, examining states' progress in assisting individuals to transition from institutional settings, including nursing homes, into community settings. And overall, using Money Follows the Person, which is in Ohio known as the Home Choice Program, Ohio ranked number 2 among all states for the number of individuals they helped move from institutional settings into the community. We were number 2 behind Texas. But more specifically, Ohio was designated number 1 in the time period that was featured in the number of individuals under 60 who have mental illness who were assisted to move from a nursing facility into a community setting. This has been a subject of some specific focus within our department for the last 2 years, and we are excited that we've assisted almost 1,000 people over that time period to move into community settings. So we're going to keep up the good work as a part of our Recovery Requires a Community initiative in this 2-year budget process. We have a number of partnerships that I wanted to highlight that have evolved in the last 6 months. Number 1, we are currently sharing a psychological first aid guide for colleges and universities. This is a resource document that was developed recognizing that our academic institutions around the state have some specific needs to assist individuals who might be in crisis and might not know where to turn. So we've got that resource document that we're now distributing around Ohio. We also have an initiative called Strong Family Safe Communities, which is a $5 million partnership that the Ohio Department of Mental Health and Addiction Services is administering with the Ohio Department of Developmental Disabilities. Strong Family Safe Communities is focused on youth and their families who might be at risk of crisis or are in crisis because of some of the challenges in the service array where there are gaps and where it's difficult to obtain services locally. We were able to fund 7 different projects around the state where communities can build out additional respite beds, can do some mobile crisis approaches for individuals and their families when a crisis suddenly occurs and folks need to come into the home and be of assistance, and also do some different sorts of training locally on how to be of assistance to better mentor parents who might have a child who has either developmental disabilities or mental illness or both. And then finally, I wanted to mention trauma. Our department is also partnering with developmental disabilities to build out a trauma-informed care approach that can be adopted by communities throughout Ohio. We have partnered with the National Center for Trauma-Informed Care, and we are going to be supporting the infrastructure to do training, free training for folks, not only in our 2 systems, but also child welfare and the courts and other emergency department staff, other folks throughout Ohio who work with individuals who may have experienced trauma. And many of those individuals are served in one or both of our systems, and so we think that we are a natural lead organization to help fund this. This is not adopting any specific model for trauma-informed care, but rather share education and outreach about the basic nuts and bolts and really put some tools in the hands of individuals who are assisting people who've experienced trauma every day. This has been a very quick flyby of quite a long list of accomplishments, but I wanted to raise them to your attention today, and our plan is to provide at least monthly updates on topics that may be of interest to you going forward. So I hope that you have found this information to be helpful, and check back for another update soon. Thanks.